Returning now to our coverage of the pandemic, the COVID surge is also affecting our children. So what can families do to stay safe during the holidays? For some answers is Dr. Vidya, Mony, a pediatrician and infectious disease physician from Santa Clara Valley Medical Center. Dr. Mony, so nice to see you again. It's cold and flu and COVID season. You treat children firsthand. What are you seeing at your hospital?
Yeah, thank you, Janelle, for having me on. So we are seeing an increase in upper respiratory symptoms in children as it is the cold and flu season. And we do have a very slight increase in our hospitalized COVID patients.
Yeah, the American Academy of Pediatrics reports a nearly 30% increase in kid cases the last 2 weeks. Are more kids, Dr. Mony, getting COVID than we realize? Because they're usually asymptomatic and we don't know if they're sick or not.
Yeah, so across the nation, we have been seeing more children test positive for COVID-19. However, the symptoms are more mild, and that does not necessarily translate to more hospitalization. So that is good news in a sense, but also just remember that children can spread the virus as well.
Yeah, we've heard the term that kids are germ catchers. They have dirty hands. They don't wash their hands enough. They've got boogers. They can easily spread the virus. Do you see that being true?
Absolutely. But I will say we have been seeing something that's more unique this year. And because children are being asked to wear masks at school and everywhere that they go, I've been actually quite surprised at how well children have been wearing masks and keeping them on. So I think along with good hand hygiene and wearing their masks, children are doing much better than we had all expected them to do.
Yeah, that is so true. My daughter doesn't mind wearing her mask at the playground for like hours, so it is great news. Now,
absolutely.
Yeah. Dr. Mony, if families are gathering like in a small type bubble outdoors, we know that is the best recommendation. Is there a way that kids can still see their grandparents? Do they go in for a hug at the knees, or should they just keep their distance?
So as with everybody else, I would still recommend that for your Thanksgiving celebrations, you keep it small, you keep it outside, and you keep it within the people in your household. If for some reason there are other people joining you, again, especially children, I would keep them away from your grandparents. Make sure that they have their masks on and keep them socially distant. We don't know if the children are infected, and the last thing you want to do is have the child give a hug to grandma and grandpa and pass on an infection.
Okay, Dr. Mony, we are almost out of time. So quickly, if your child is sick, like sniffly, maybe having trouble breathing, should they just go to the doctor right away and call their pediatrician?
Absolutely. They should call their pediatrician and get tested because, again, we don't know the difference between COVID and any of the other respiratory viruses right now.
Okay. Dr. Vidya, Mony, thank you so much for your time and all your hard work. We know you're exhausted. We hope you have a safe Thanksgiving. Thank you so much.
Thank you. You as well.